talk about is that we're very different. How many of you agree that healthcare is a little bit on the wrong direction? True or false?
It sucks.
How many of you in the room are healthcare professionals? Can I see show of hands? Quite a bit, say maybe 30%-ish, all right. So this is just an example of how off the tracks healthcare has gone from thinking that you can treat nutritional imbalances with pharmaceuticals to now going to structural changes in the body like bariatric surgery to this recent device that was approved by the FDA. It's basically forced bulimia. This little device takes the nutrients out of the body before they even get into the digestive tract in an attempt to lose weight. How sustainable is that? And it doesn't address the underlying cause, which we all know the underlying cause of overweight is lack of well-being. Yes or no?
Sure.
Right? So we're going to go through in some detail a lot of the tools that we have in here. So we're not going to spend a lot of time on the tools. We're going to talk more about the philosophy, the approach, the conversations, how we get. But all these tools are really exciting because many of the people on this panel here helped design the Health Professional Kit, which we are going to go through. But these are the 3 core principles that have been Take Shape Life, remain OptiV and Take Shape Life as we go forward. But we also have this community of OptiV we're going to focus more on. Some of these tools are very effective for you to spark interest and start conversations. Just like the well-being evaluation gives us a chance to have a conversation about somebody's overall health and well-being, some of these tools can be used to really start a conversation with a health professional. We're going to talk about how to do those. But before I do, I want to ask Margaret to share a little bit about how and who is really effective at approaching health professionals. Some of you are new. How many of you have been with Take Shape for Life for only a couple months or less? Okay, good. So you're still in learning mode. But Margaret, there's a way to support you, even if you're brand new to approaching health professionals. We're going to talk about that. But Margaret, why don't you give a little frame for who's a great candidate for this?
Sure. Can you hear me? No.
Okay, that's better. Thanks, Greg. Yes, so as we start, and I guess I get this job because I am a lawyer. I was a lawyer at one point in my life, a retired lawyer, I guess. So in the policies and procedures, which, very important, we are all responsible for knowing what's in the policies and procedures, and so just want to reference that, and just as a plug for that's a good thing to go back to every once in a while and look at for different aspects of the business. So because there are new coaches here, the first thing that's very important is to approach healthcare professionals. A new coach needs to be an executive director and be certified. And I would add to that, as a new coach learning this business, if you want to approach healthcare professionals, you need to work very closely with someone in your line of mentorship to help you do that, because that's a very particular skill set that one can develop, but you don't want to do that on your own, thinking you can do it, getting into a situation where you're asked a lot of questions you can't answer, and you basically mess up an opportunity. So as we always say, work with your business mentor. It's particularly important in this regard. Now the exceptions to the ED certified rule are, if you are a healthcare professional, and there are a fair number in the room, you obviously can approach other healthcare professionals. And the other exception would be your personal physician or physicians. That would be an appropriate person for you to approach. I would again say better to do that with someone in your support team who can help you present and answer questions.
Thank you. Thank you. And